Right, ni bena ntuba kwithirwa kiona akanya ka nindi na kwatanira na batu orobweru ari arankwenda twitha tukiara kia mantu mwanya nindi yegie mantu ya rwangiro ugima deni akaunti ya Meru kumani kinya no tongiria bobweru imbibyo pyongwa byombete kwithira bikialuka imaugaruku yako ya kubwithwa kire ugima bamwiri na bearing in mind that rwangiro mwerwa rwi very sensitive kinya kire utoro bamuntu no tokethirwa tena afya enje mwiri is a threat kana ni onto kinya boteagiri nikionto orobweru ene twina mandaitari baile ndani ya studio probably tukirikia discussion bwankethire nyande kwa ndaitari obathato kana ndaitari in the making barankethira nende nkiba ya kanya bambe ukethia na baichi introduce bo bauri tukethira tukuma nende kirwa ria rwetwara muno kira tukethira tukelekia ntukuyerua ni mantu yegie Ugima Bwa Ekuru muno nende ke the process of childbirth kana kwa wana twambiria we waziri karibu sana maybe no ithire wetwira mwa no twire iwe we know but we need to kwenda confirmation
sure ibwega bwana Phineas man ampambe nkethie mumeru wonthe o ari ndene mugongo jo Meru mpambirie na kuga dieta ya kompeta wa daktari Dennis Muriungi Mugambi na ntobaba ingi mono ibambije kagita karanda atetera madaktari de chairman yo biama bya gutetera madaktari dene county ya Meru biama bira bidara byarunga merite mantu ja ugima bwa mwiri ende nande de waziri kana CCM uria urungamirite mantu ja health services kana ugima bwa mwiri ndene Meru na arua tuketha tukiarairia nteto iria ikonie kana ikuhusu mantu ja nteto cionthe cia ugima bwa mwiri na mibango ira twinio ndene thirikari governor Reverend Isaac Mutumantu Ethingia kenda batu twithirwa mu Meru ethirwa akimenya aria turethire thirikari iri na aria batue twamikinyia na aria tukwenda thirikari iji in terms ugima bwa mwiri ethirwa igukinya mu Meru ndene gipindi giki Murungu atuete. Asante na ibwega.
Yes. Daktari Gatumi
Muriani kaire Dietore yakwa metawa Dr. Consenta Gatumi Mate mbithagirwa andi daktari wa thina cia ekuru kana ira ciwiki wata thina cia njira ya uciari ndutaga ngugi na hospitali nene ya county of Meru Theo Meru Teaching and Referral Hospital.
Thank you. Hinyao ni ndugu nda daktari daitari. Hinyao ndio tuwafinia zetu ntinda daitari. Probably I'll be. Nkiambiria na wewe bwana minister, to know the difference in two and daitari. Tukailia mantu yegie reproductive health na kinya child health in Meru County. Agenda ya thirikari ya His Excellency the Governor imbibi byongwa kana moroto yokiri imbibi byongwa korotera in terms of child health na kinya reproductive health.
Kiri thirikari Governor Mutuma to think here number 1 yentu kiraba tukwenda go focus na kyo kimanto ja maternal, reproductive, neonatal, child and adolescent health na nteto chia nutrition itobangite number 1 kwethirwa atindene ugima bwa mwiri bwa Meru County to align na kintu kira tuga pillars ira chia vision 2030 specifically pillar ira itawa social pillar ire ko konie mantu ja kwethirwa provision ni tukotha tugi provide health services across Meru County na njira iria ibatere chiethirwe ati jonto ibuje health is devolved kana itwa health ni umire na aria kethirikari nene ya kethirikari na ndicha county government the 47 county governments but to focus yetu ikwethirwa number 1 ati o muchiari uria okwewa mwana na kwethirwa akewa mwana na njira iria yarigirite na kiudumiagwa ni aritibango gibafia bara be qualified kana bara ba itimete betete skuru na bakwithirwa nandi ibakwithwa bakimudumia echibitare ura kwagirite na njira ira yagirite. Kenda number 1 tomba batu kwithirwa ito eliminate mantu tugwita maternal mortalities na inya kwithirwa ati kurba kewa kana utimwe kuru kwithirwa gita uturo bwawe na guti twana kinya tungwa ito kwenda kwithwa tukigereria bonene sana kwithirwa guti kana kinya kamwe gakwithwa gagita uturo bwako gake janthiguru ici. And secondly kana kau gakinya kethirwa kongo igakumbi kwithwa gakimenyerwa na njirera yagirite kenda muciari nandi akiumenya cibitari ethirwa kana kawe gutina complications agita na konja na alafu kwambiria u weje withira batu ito kuthingatiria nteto cia immunization kana iria
nchachamo
kumuntu nchachamo ore ciagirite ito ku protect kana na inya ito kuongera nandi functioning ito gweta nutrition ati tutho ito kwithwa tuki advice kurubetu bara bakwe twana na families ciao ore kana kabati kurerwa kenda batu tombe kwithwa ke mugongo jwa miru twina ana beno Ugima na mugongo jwa miru juina Ugima kenda mugongo juina Ugima jombe kwithwa na ndijo go translate ke witi bwangugi na gukuria mugongo jwa miru urajo agirite economically. Yes.
Wow, perfectly put. Dr. Gatumi tukielekea PNC mbere PNC imbi because it relates kema tunegie uchiari kana kinyekuru kwa wana.
Yeah, kwi PNC ira igagwa ni service ine nkagirwa kiri mwekuru arikia kugia na mwana na pia mwana wewe ngwa arikia kugia noe. Lakini nyambe tutira kinya kwa PNC kwa kintu twetaga antenatal clinic ira inuwaire ANC. ANC neo ni ta umenyeri bwabu nenkagirwa kiri mwekuru rira kamatite kuma kagita kara kiwa kamatete mwankarira akegwa akigia na mwana ino twita antenatal clinic. Na nenkagirwa kiri mwekuru wonde urakamatite. Itwije kwena chances ya kwegwa mwekuru no athi through the pregnancy atena thina lakini utiumba kumenya no nundu kuma kire ekuru bakamatete about 20% ya ekuru bakamatete bego bakio face a type of complication na kenda complication bakumenyekana ibwagaria mwekuru kwa kithingatirwa kiri antenatal clinic kendo kwa kwina thina kuonekana atukana kumenyerwa mbere itiraendelea kana inya umba kurigiria kenda kugia na mwana tukwena thina kana wewe ngwa ewe ena thina ikuma affect health ciake.
Advantages kana itumi kiraumbe kia kwithira weya mutaalamu ukiri komeda kinya ANC kimuchiarire kana kimwekurura maybe ako expect ku deliver maybe 9 months itumi kana advantages weya bontu boni ya buriku.
Kwena advantages nyingi irachiwa mwekurura kuthingatirwa in the antenatal clinic akwiwa kionekana. First time Phineas tuga kinya mwekuna betogwa kionekana inyambere atiragia nanda mbere atuka pregnant no twita preconception no ndira onekana inyambere atiragia nanda na kuwa akithingatirwa kuonekana kethero mwiri wake we ready ukamata mwana na omba kuyana mwana sawa sawa. Na ria kuthwa preconception care kwa kwena advantage kuwa kethera kuwa kwena thina kuonekana ebo kweke affect the pregnancy kana mwana nyumba kwegitatuliwa inyambere atiagia conception. Now advantage ya kithingatagiro ria kuthingatirwa ni kwethira ukaya kuwa just in case mwekuru akugia nanda ratia atari akuonewa preconception kuwa kwena any problem yatuke kuonekana na muno kaiwa ikuonekana mapema akamba gutethirwa kuwa ikirigiria kwegwa ni gwa affect mwana kana wewe ngwa nontu kwethina imuciyana jaria mwekuru aya na mwana otwa iro kwambirira ya nanda iro kwambiria na ria kiwa kiambira clinic then ni kawi ikionekana. Second advantage rira mwekuru kuwa kiendelea kuwa kono in the antenatal clinic na kwena advantage ya kuwata kithomo buromba kwegwa wikaria hygiene na buromba kwegwa akiendelea kwegwa akienda kuruta ngugi ciake na muno kaya kwithirwa irio akiwakio under the first time nyane wakiruta boko mbakinya kumenyera mwana wakirera ndirakeigwa kugia na mwana kuwe ni advantage na also kwin advantage kwa ria kuonekana ni during the antenatal clinic na kuigwa also akiwata kuwata ku ma kithomo nkoroki yabwengo kwa ena kiombereni na ukayakuwa kwina problem yote kuonekana nikuigwa kierechwa mbere aya nyambere itetuka kuwa ni kuongereka muno
na tukielekea on the same on tunende tukuona the advantages kana we yapo kwithira kwina antenatal care Dr. Dennis, I come to you. County ya Meru kana thirikari ya county ya Meru, which your part and parcel of health facilities ira chindene ya county ya Meru, are they able kwaya na kia iki ya chiari kana no mwanka mtu adhira ita ki specific clinic ontombuga kwe mtu arari wanende ondenda yuku ina Dr. Gatumi ya dhairari kenda mbita, of which will be a long distance to many of the people. Are Meru facilities ira chikore kwicho ichi dharekia na utungatapo kire ya chiari?
Bwana Imana batu tuwe na thirikari Meru County Government tuwe na shibitari kuma level 5 mwanka level 2s na level 1s chibitari magana jairi chegana rimwe na 15 215 na chibitari uchionde mantu ja daktari Gatumi area ja antenatal clinic chibitari uchionde ichikuejana kwou ge chibitari cha thirikari chionde ichikuejana no mpende nya kuongera kwina chibitari ingi tueta faith based kana machibitari jaja kwithiro ja religion cha makanisa ito ta mission hospitals ichikuejana tuena additional private facilities inya chiongo nene Meru County chitharukejana antenatal clinic kwa wantu betu ibaigwe wote chibitari bomba gutonya na bationa utungati kana batiomba kwithwa bagitegerwa idaktari.
Wow.
Yes.
Awesome. No need to go long distances.
Get a long distance, but to make it sure at within kilometer 5. Ori ukathiuruka kilometer 5. Kukethwa kwina chibitari thirikari ndene Meru County area gukudumia. Kwao ukethirwo gitangatanga muno ugeta u next na chibitari na tuka make sure ati ugono kuonekana na services ciaku ni kethirwa ugishughulikirwa kubatera
na kwina mantu mbere nke ya Dr. Gatumi Bwana Dennis mantu yegie maternity services. Yes, tukwithira twina the antenatal kana inyitu ethirite twina the PNC mbere kinya after delivery, lakini mbere twithira tukia PNC kana postnatal maternity services cha county ya Meru okwithira witarira kia there are 215 public health facilities iranto mbike kwithira bakiona utungata kwa ANC. What about care delivery? Yes, tukumenyera muchiario after 9 months au kinyeita nenderea kwa kitheri mukethirete maternity services ndene ya county ya Meru. How is it?
Chibitari chonde 215 tichonde kwajana maternity services na mumeru nabati ingwete kitu bati jonto ora mumeru ali nabati kumenya chibitari area ya kwenwe area kwa jana maternity services.
Sure.
Number 1 kwena chibitari ya tayari chikwa jana maternity services as of now na kwena chibitari ira batu to waka ira tueregerete in the next 3-4 months tukethirwa ikeja na maternity services. Kwa mbuga Bwana Imana iwo kandekeria tungwete kenda mumeru ari omba kumenya chibitari ria akwe nae na nkomba kugweta chibitari ukulingana na regions kwena gendo tweta sub counties sub counties ndene Meru nkomenya andu bakwerwa kwena iria former constituencies iria tuga constituency kenda lakini ande kwena other sub counties iria tuongerere especially ke matters health na kinteto chia wathani na jurisdiction ewo oka mbetikeria ndome kenda mumeru tutikeje kuthithia makosa kenda mumeru ethwa na kumenya aria wongwa abatere gwita na nkamberia na Igembe North kana side area Elare na Mutuati. Kukeji kuthro ugo mumeru na we side Elare na Mutuati twina cibitari Mutuati Mutuati level 4 hospital irai Mutuati ina maternity services na ni gwitangugi as of now kwina dispensary ukeji kwithwa we antu kugwitwa antu betwe kiongo kwina dispensary itawa Thera Health Center the dispensary is a health center itawa Thera Health Center ina operation ye maternity. Na ni enderete indirari no kimekethiri na ndethira mwanka maternity services uchiambiritie mweri jumwe jothiri mweri jumwe governor mutuma gutonya dispensary wirio twatumire ariti bangu gino ne ya functional Thera na Thera tayari ndi na details chayate ndene mweri jumwe Twana 20 itwethero to care delivered kana to yechiarirwa ora tugake mumero ara Thera dispensary health center sorry kwina Lare health center ewe Lare kwao ukaji kutho Lare au ke Gembe North services ukona ke health center uchoijire na level 4 hospital Mutuati
sure
tuije Gembe South Gembe South side ye Mawa town naja kwa John Paul kwena cibitari level 4 itawa Nyambene sub county hospital kwena Kachio health center na kwena Kegoi health center iyo cibitari ithatu iria chikwenya na maternity services na chionde chigwitanguge utukwaria thaiji tuije Igembe Central Kangeta health center ni kwethirwa ikeja na services yu kwena Tigania East Tigania East side ye Muthara kwe ingome andu betu ba Muthara ibeje kwena Muthara sub county hospital ni kweja na services cha maternity ne nyamata services cha theater it is functional
wow
then kwena Tigania West side ye Kianjai na kwa mheshimiwa Mutunga kwena Meathene sub county hospital kwena Mbeo health center Mitonto health center na Mweronkanga health center kwena gintu gigwitwa Tigania Central side ye aja side ya Mikindori kwena Mikindori sub county hospital tueje side ya Bori Bori tuganitie Bori West na Bori East na Bori West kwena Timau sub county hospital na Ontulili health center Bori West then Bori East kwena Ruire health center kwena Nari kwena Kibirichia na Kirua health centers each on they are functional in ukeje kwethwa ugetha cibitari u ukaerwa kana u na ukaewa kana ukiudumia gwa ne anto skilled then tuje guntu gugwitwa Imenti North kana Mutindo Okangangi kwena Meru Teaching and Referral Hospital Dr. Gatumi alimbira nande itokwenda ko convert very soon ke thirikari mutuma to think here itokwenda kuongera gantu gagwitwa research hospital the teaching and referral hospital okay itokwenda kuongera research kenda batu turia miru nande tongera ka component ka research twetho itokumenya kaumo ga cancer ina to focus tena mantu ja cancer muno ke research kenda athomi bara bathomete miru iji batonya ja batura na cancer iji kuma ya ri ina itite mbere nande air level 6 ora tukwenda committee the level 6 status already itumere nande research hospital okay na maja muro kwena gyaki anku okera muro John Timothy notore muto thene thaici alafu tuete Imenti Central kwa mheshimiwa Kirimanguchine kwena Kaongo health center Gatembe health center na Githongo na Githongo ile level 4 hospital na tueta Imenti South side ye Daktari Shadrack Mwiti kwena Kanyakine level 4 hospital Mikumbone dera side ya Ruguru kwa Mikumbone health center wena Muro kwena Mitongo na kwena Kinoro kwa ukeja gutegera cibitari o ara mumiru ari maternity it is functioning na ukeja kwithwa ugakinya cibitari number 1 uthirwe antenatal care then now u proceed nande batu tukujukirie kumau na nde yondo chibitari 215 lakini no kuichi chondo 215 ira china maternity there are specific hospitals ningo etika ngochidoma ngako provide list yeje kenda ogwe okaroke kuruka iri ari ameru baketho bagotega TV bakoni kurukira ari andeguru kenda mami beto bageta chibitari baketho bakomenya chibitari ira ina audumu bafya bongo bara be qualify na yuje chibitari
perfectly put na after delivery after maternity kwena nende PNC daktari Gatumi sorry ile mucheri abatire kwedira kyambira service nende akwedira ita in the mentioned aforementioned hospitals kwa mwana PNC abatire kwedira kyambira is it immediately can after some period of time
PNC teo postnatal clinic care ni tuge services ne kayora mwekro arekia na kugia na mwana ideally tuwa mwekro with ekro bonde bete kugia na ana by sibitari kwa care yambagiria woriore arekia kugia na mwana are in the hospital within the first 24 hours are ewa brete kwa are in the hospital akemenya wera we na mwana wake na oka ya kwethera kwa bahati mbaya mwekro pengine kugia na mwana bere atira kinya sibitari kana pengine ayana mwana muchi na bwire atibeta gukira abwite kuthi directed to the hospital kenda amberia service postnatal care now ituga postnatal care kan ekanda mwankarira mwekro kwa kinyithia 42 days yo tuga now mwirwa mwekro guchoka nomo na hormones yake au kinya state tire wa tamwekro atari kurekwa kuwana pregnancy the first 24 hours if it's normal delivery mwekro bito karasibitari kenda wera iverwa na kwe vimbia gwa kibwa akerotherwa na mwana na during that time mwekro na bond na mwana wake na nakurutanwa manto makumenyera mwana in fact nyakwambira ku breastfeed na bora mwana kamenyerwa then after that okay we normal delivery mwekro nategura kwenuka on after the 25th hour after the 25th hour nondo akewako the immediate after delivery then after the 24 hours then after that mwekro napita kuonekana kairi between 7 days and 14 days if it was normal delivery. If it was a cesarean section kinyana pita kuonekana. If it was a akethera egera na mwana through operation na bwire tu kuone wa bantu aria kwena daktari kenda omba kuraitha kironda ona kethera ke sawa sawa kana yitie sawa sawa na ituga kaya kwa mwekoro atire na any problem akanenkero another time of about 4 weeks raka yakaire kuraithirwa but atero now postnatal care korekia na noendere na kwa kwena any problem na tuka advised accordingly who the postnatal care meaning for the mother and the child kire mwana no erotro ithagiria ni kwithirwa muno rutaro kou ketha irukora bwega kana mbokwa rwena infection na pia kinyamwe nini mwana kaitha kethira na kwi mwana ni mabarikia kugiciarwa pegwa bena thina ya gutweka yellowness of the knee not to jaundice ko akaitha kethira ena thina ta no ntuni it's a serious problem kire mwana rirachero katuka na kuigwa ena yellowness of the skin kana of the eyes na also mwana akaitha kethira na ko gain weight bora kwagirite so all that is part of postnatal care. Yes.
Na tukiona the 42 days na botariria muchiari kana mwekura batire kwithira when I say mwekuru ndemaanisha mwekura mwanokie abatire kwateda clinic for how many times kana how many days? Yes, 42 days lakini ni atika segmented maybe you have to kwitha kana ka depend na branda itare akona response muchiari yo
tuichokire antenatal clinic Ministry of Health dine kanita guidelines na yugaga at least mwekona bute kuonekana at least 4 times egitaria pregnancy lakini nitie cast on stone no okaya kwethera mwekona kuonewa any other problems no wakenenkerwa more frequently cia kuja kuonekana kuringana na kiama kia Ugima Bwa Mwiri nthiguru yonthe yugaga the number of times no we even 8 to 12 kuringa na ba mwekoro ria kwendelea kuona ketha na kuna kwena thina for example we mwekoro na complications during pregnancy na utweka utumba kumwani tuko indaja kwa wi prerogative ya daktari ria ona mwekoro akamwatariki lakini at least 4 times rira akamatite. Yes.
Wow. Na nkienda tuchoka ringi, but I come to you, Dr. Dennis. In terms of emergency cases, tukiona ndaitari kwithia tutari kwi boba chiara irwa kana kuyana bothera bakiona irwa na umuchimbwa mwekurune yite na kinya complications chia maybe child giving, especially mbua as a first time mother, no kuthire kwenda complications. How prepared is Meru County in terms of correspond ke emergencies chia reproductive maternal na kinya such services? How well prepared and equipped is the county?
Number one, ukajikuta kwina any complications ama emergency services. Iria chumba ikwithirwa ikiendekana kagitaga kweja kamwekuru akewa mwana. For example, tuge matters to do with functional theaters ni tubwa cesarean sections kana ira tuita CS. Inkwenda kugate kwena chibitari iria china fully functional theaters. Then Meru County na iria china daktari betu baraba gushughurikira kuru betu ba Meru. Ukandekeria nchigwete twambiritie aja mutindo kwina chibitari Meru Teaching and Referral Hospital kana chibitari nene mutindwa. Then ruterwa rungi kwina chibitari ya Kanyakine, kwina chibitari ya Nyambene, kwina chibitari Miathene na chibitari Mutuati. Iwi china fully functional theaters thaiji. But tuina referral systems. Ata kukejikuthwa kwina any complication kana emergency. Number one, on tuwetu biapati kumenya tuina ambulance 19 then Meru County. Na kwina referral systems chia kwithirwa o awuri no kwa referred ge chibitari iji no kethwa go no kuretwa na ke ambulance iji imwe china era tugwita ACLS kana a fully functional almost an ICU type of service then ambulance cheto yuto Nigeria. Lakini ke referral system to ina an additional ambulance kenda. Kwa hiyo ukejikuthwa wogeta chibitari daktari bongo iba kumenya uria referral system uria ugatumwa ario bati gwithwa gweteri na kwithirwa kwina system muntu uria daktari uria agigutuma kwina daktari bangi bagweterete rutero uria kenda umba kutharangwa ugo mantu jaku yethuru ya kumba kwarakishwa na jomba ikuthora ugo no kumba kuona utethio. Yes.
Wow, perfect. Yes. Na Dr. Gatumi, in terms of kananwithire to AK field 4 years in Meru County in terms of PNC na kinya skilled delivery in Meru County, how are we doing? Are we doing pretty well? Are we improving? Kanaiturwa miamwe kanaitu kwena mandi basically ni ati the department yendelete
tia tombiri na the skilled the deliveries by skilled workers. Ituije tia ndubonde baba isibitari ba by conduct deliveries kwe bara by trained go conduct the deliveries. Kwe percentages ira luwa ya kuruba by delivery conducted by a skilled health worker. Tia ndifai my
sure.
Kile mwanka mudhiru 2024 Meru ni arina about 12,310 deliveries. Na sorry, the number of deliveries were 30,776. Na out of this only 60% are attended by a skilled birth attendant. Meaning about 12,300 but chiarire battery attended. Na tukayo compare ratio na the national average. National average last year about 70% ya Ekuru bagire na ana bari attended by a skilled birth attendant. Na nationally kwa ina a total of about 1.2 million 1.2 million ya Ekuru bara bagire na ana 70% for them bari attended. Tukayo compare it ya Meru na the national figures. It looks that we are not doing very well. No, our rates are less. Mini kwena kwena ekuru mo baba ta utweka attended by the skilled birth attendant.
Yeah.
Tiatora either indicators rengi ira tu watu we consider rera mwekuru akoya kenda tumia kenda reproductive health iri sawa sawa or not. Ituga tugotariria kere the adolescents kere among the pregnant women, how many of them are adolescents? Ero ni measure ya kuonania no itu adolescents that is girls who are between 15 and 19 years. We having quite a number of them papa kuyanana na mbewa bari at a disadvantage no to work with mwiri yao they may not be ready. They are likely to have more complications during the pregnancy or after the delivery. Kuringana na report ya 2024 in Meru, about 28% of the pregnant women but in the age group of 15 to 19. That is more than a quarter. The more they are, the more list of complications. And this is a much higher average to compare na the national average, about 17%. The girls between 8 or 15, 19, Meru in a bigger challenge. Na toka ya kuraiveria from the KDHS, this is a Kenya Demographic Health Survey, previously, 2022. That time, the Meru ya Tarawayena, only 24% of the pregnant women being adolescents. Kona last year, yari 20, yari 28. Like 2 years ago, it was 24, meaning what? It is it's been rising.
Yeah.
It will call for a lot of involvement of all the sectors, on how we can bring this down so that we don't have many teenage girls into the mothers when they are not ready.
Sure.
But maybe through the per county.
Yeah.
Through the 9 sub-counties ya Meru, there are some sub-counties that have higher percentage than that. Especially in the Igembe South, about 38.4% adolescent pregnant women. The other counties like Bore East, they are in 15.4%. Igembe Central, they are in 42%. That was the highest. The number 52%. Of pregnant women who were adolescents. There are others, I don't get through all of them.
Sorry.
And the numbers, we need to do something about this. From there, here try the number of the ministry recommended at least we now 4 antenatal visits mwekuru akamatite. Ikwari na survey ya ruthitwe 2022 irayona na ya Meru County had yari na only 45% ya pregnant women baomba ku achieve 4 visits or more. Again, figure ni a bit lower when you compare to the national average figure, which was 66%. Yeah, bakiomba ku achieve the 4 visits that are recommended. Still together with this, itokuona that the sub-counties carry their different figures. Again, there are some sub-counties that are not doing well, like Bore East, only 45%. Ekuru ba tende clinic wambia ku achieve at least 4 visits. But there are others that are below the national level, like the Imenti North. Imenti North had slightly more who were attending the antenatal clinic, who at least the 4 visits. Indicatoring it right there to kwenda kumenya kedira reproductive health service within the country are doing well is the what you call the contraception prevalence rate. When a number of ekorobara kamatete married women between the age of 15 to 49, how many are on a contraceptive family method? Nationally, the rate were area about 63%. Like in Torida, at our county, only about 45% of the women were on a form of contraception. That I now about the maternal mortality rates, the ratios. As a county, Meru County maternity ratio ni about 202, ni kumaanisha out of 100 live births, we end up losing, we may lose about 202. However, this is a better performance than the national rate, because the national rate, we lose nationally for about 355 women during delivery for every 100,000 women who have delivered. Still, even if we are below the national average, we are still above the recommended. According to SDG, SDG 3.1 no ya addressaga the issue of the maternal and the neonatal care. Now, it recommended that by at least by the year 2030, we were to reduce the maternal mortality ratio to below 70%. Now, still we are above there. However, these are figures for 2022. By last year, around 2024, there is a decline on this. And said that by the year 2024, the MMR for Meru was around 230. It has slightly reduced. There is a slight decrease in the ratios. The maternal deaths, according to the ratios, it are including those who have delivered outside the facility. The number of deaths within, of getting the services within the facility, the ratio is much lower. It's those who have passed on when they are getting services in a facility, the ratio is 65. If the women attended antenatal clinic and delivered in the facility, it reduces the chances here during the delivery.
Sure.
Lakini hatu utara the facility based maternal mortality ratio to utara bara pengine people have died maybe in the community, only those who someone has died within the facility. Yes.
Wow.
Yes.
Doctor, let me come to you, Dr. Dennis. After His Excellency Governor Mutumaigo Kiochiathi kana wathani ethiria kioka kia this year 2025. Kwebu maybe your ministry ekubwithia kendo tira these figures chia teenage pregnancies ni kwethira kinama, because I'm pretty sure ikethira kinama kinya these other things will be affected on a good or rather positive trajectory. Kwe maybe ontobo kubwithia maybe kwatana na ikundi bingi onto their organizations ebirachi ethiria kana mbere mantu yegie kweria ko eradicate teenage pregnancies. Okay, akwalia figures ira Dr. Gatumi ethiretwa ya they are not good. Na okay, akwalia interim, it's not Meru on there as a whole. Okay, akwalia ya Gembe Central in a 42%. Okay, akwalia Bore East in a 15%. Quick into maybe your department ekubangania kwethira ikibuthakia, and at the same time otwire mantu yege functional newborn units then account ya Meru.
Thank you Bwana Imana. Gento kirabatu to waterete muno ke thirikari Governor Mutuma to think here. Number one, ikugeria kuritana wananchi through madaktari wetu. Number one, ira tuita health education. Ukeja ukethira twenturene ito kwethirwa tukiomba kwetho tukiara iria ana betu na achiari betu na gintu twita family unit. Ukeji kwethirwa ugo mwana na kumba kwethirwa akiarirwo kumanja tuketho itukoithia health education na tulithia health education yeje atia mwanka tha iji batu twina antu bagwitwa community health promoters ngirithatu magana mugwanja ya 16 antu baba tubatumite nturene kenda bathithia era tuga home to home visit kana nja onja bakiritana kintu gitawa health education na bakimenya mantu jaja gutuma twetho twina rates chiregoro chia ana betu paraba batiko betite maskuru ri
Sure.
bakieja wana imbio ikwetho ereau. Na one of the things ke research yetu ira batu to tegerete for the few days irandira of midrito ndi office kintu kimwe uchonkoga gikoyo kiora kuma kiongo na itubati kwaria uma ntukwira turi ajinyetha twi daktari mero kiongo kya mero kya gikoyo kya mumero ikirori ende thaici kiongo kiu ikyo kona mumero ararwire mwanga kiongo kira kirora kenda kioria mwiri junthe ikirachencherie na ndi kiongo kiu tayari kina inya na nandi ethera kiongo kigwatire inya mwiri batu nandi tuenderete kujugwatithia inya jonto chibitari chetu kirachigutiganirwa mantu ja health jarari jagutiganirwa na thaici atwambiritie upya itubati kwira mumero nandi ikyo kuona michemanio na rwejo keja gontega bwana imana no kona impimbi metho jonto tiko goteko na kumama batu ingoge tukogeria ku recover ngogerete itwa miaka 2 na nusu jonto batu tu na miaka 2 na nusu egwita ngoge mbere election batu turenda kungangana ngogerete itwa yonthe twethurwa itukumegwatithania yonthe nandi yombe kwethwa ni gwito thaici na gintu kiu bwana imana ndienda tukijaja in the next 3 months kana in the next 1 year daktari Gatumi akeja na ugatwito kairi neja na statistics tokethwa tuko reduce statistics iji twethirwe ana bara na ndiba kwethirwa between 15 years mwanka 19 bakwethwa bakewa Twana thaiji baunda bakethwa toko bachoke skuru bethirwe benderete na system cha skuru bukumenya basari chirari jikura kagita kala basari chule maskuru na nange mwana atena choice other than gochoka nja na achoka nja kwena achali bamabera muntu na ndethera mbeja je skuru ikora ugita atia ngorwa kwigwa mantu jaijo tukwenda kunyia miru kenda batu to focus twithro mugongo jo miru jo gukira juri amwe na ikyo kuona gintu kira kiathuganirwe giki mbere gavana mutuma gutonya augire mantrewe I building meru together twithro turi aka mugongo jo miru twinthe turi amwe kuma ari anja tukiritie kwa mantu ya jonde tukuthia mantu ya health education na kwithwa tugichokia ana babara barari baguta skuru bachoke maskuru kenda ana bonde bedrwa ibakwerwa kithomo imbi bakwerwa ura mugongo jo batigweta na mbere na advantages na disadvantages cha kwithwa ugo number 1 advantages e kwithwa no gweta skuru no kethwa kithoma uri okomba guchukiria maishene and disadvantage tuituma daktari na aja kubathomithia cia kwithura ugo nukwewa kana at an early age. Yes.
So because I'm pretty sure Dr. Gatumi imanto either akiona in her line of duty na yamu kithia bobwe so no ko make a promise to her, to me na ke viewers rwangiroro ketha rwechinchaki especially ke
rwangiroro turenda butwe mieri 3 na mumero wengo no karinga thimwaja auge na ngwetike tayari mumero wengo na ijina ndingo gira tweetete nteto cha cancer no kumeitwa launch wethera batu na ndito go screen cancer ituretete ituthete mantu ja blood transfusion ndamwirera urite miro ira ithairo rimwe ikiura ukejo kethera mami betu bara bakwithwa bethieta na nangi bakwagia ndamu ukethera bagiota uturo bwao ibonere governor ewengwa anambiririe blood transfusion drive aja headquarters twekite headquarters governor wengo noe waitero ndamu kwa iboko ingwetikia mumiru tayari nonete kwina change ura witibwango ubo gwita kintu kingi ukambetikiria mbuge kanini ke witibu wangu ge alitubetu bango ge afya ibara inyerekete mono kithirikari ira kuruka na okagito ura bwana imane nyagwe ngo binadamu omba kwetho ogita ngo geaja muchara yo kuchukethwa juire wa after mieri 3 ukethera maloni jaku jatukumba kurewa ukethwa ugo morali nyaja gwita ngugene ari jonyi thaici na arweji morali jwa alitibango ba chibitari na alitibonde bango ba Meru County ni ari egorojuri jonto na arweji gavana mutuma atini nyera ndo ya mweri jomwe ya muntu nyomwe gutina muntu na arweji okuringirwa thimu banki ero kwena gintu gya gwekendwa loan chao ichirei mbeya chao chondo ichirei kwao ngugi ora babateri gwita cibitari but na excuse kia gwita ngugi. Thank you.
Our time is running out, lakini kwithiro kiara kia mantu yegie blood ngakuri onto bomwe na kinya mantu oxygen. But before I come to that, Dr. Gatumi, mantu yegie delivery kwithiro kiara kia mantu yegie kinya skill delivery, home delivery advantages etomi kirombe kia kwithiro kira muchiari owentu kuchia kucha kinyecha ku deliver mukaire go to the nearest facility for safe delivery. What is a good bit about skilled delivery na kinya muchiari we ngwa kana mwekuru kwithira kiona ira mwanu kiarande ni chibitari?
Advantage there mwekura guchiarithwa ni a skilled birth attendant as opposed to there guchiarithwa ni pengine traditional birth attendant ni kwithirwa ati mwe oyo are trained mantu ma uchiari na komba ku recognize any dangers na muno kakwa kwena any danger ne utkuwa are prepared kutweka handled. Kinya as opposed to there mwekura guchiara from outside through akaya are already na risk. Ituije the risk cha mwekuro tarari kia kugena mwana highest just around the time that agena mwana. Na the largest cause ya maternal death ni hemorrhage, bleeding. Na okaya kwa mwekuro achiarira pengine gututai na skilled attendant within 2 hours mwekuro wewe ake lose life. Ria kuwa are na skilled birth attendant na kuwa kioba kujokerwa atua araka mapema mbere atira tuka affected by the bleeding kana any complication.
Sure.
Yes.
Wow. Na Dr. Dennis mantegie blood kwithira kweta ki kinyam ekuru kwithira baki bleed to death during childbearing kana bakithari mwana blood bank emeru ne atekari do we have enough blood kana we don't? Na kinya actually mantegie oxygen is another issue. Do we
sure
those two kindly address them?
Nande mantu ja blood and blood products kana damu area transfusion gwekerwa damu batu tukwendi kuga the IG to na blood satellite center at Meru Teaching and Referral Hospital na satellite center ji ne kwithwa igechonko na damu ne kethwa nego process damu area ne kethwa nego supply facilities zinge within Meru County and even outside Meru County itogotege mwanka na ndio kethra batu tugotethia the other hospitals the surrounding counties chetu itukomba kwithwa tukibate
na functional thai.
It is functional. In fact bwana Imana rojo rokere mashabiki jaraja timu etawa Manchester United ibejete ofisi yakwa njonto ibaronere ngogera togwita towards damu na nuje mashabiki benda muno ingoti kigoba cha mugabo na ndi antu bau nkuruki mashabiki 500 bakedo abejete rojo na tuko atongeria bakedo abejete rojo kenda tugwatanira Jumaine bonde bakedo bakeja na damu iria ega processor Meru General na ndanko hopu inyati mwinge jabasa na inge chikeja kuwa mashabiki wa unyabonga beja bato join kenda tukolia mugongo ja Meru mbio amo twinde
pretty
kintu kingi twari ya manto ja oxygen na rueje kwena system oxygen area tombete kwedroa to in partnership na donor funding global fund na AMREF ito dioro keta cibitari chionde cha Meru AMREF na global fund na batwe na ngwataniro thirikari county Meru ito mbeta kwetherwa kwena oxygen plant a functional oxygen plant Meru General ito ekirite system a system ego supply oxygen Nyambene ito ekirite system ego supply oxygen Kanyakine na ito ekirite still to county government ya Meru ito mbeta gutetheria mwangashi bitare gweto mawa Methodist Hospital is a mission hospital inyayo ngo kwetherwa ni kwetherwa ina oxygen plant processes which enderete na inkwenda ku reportera mo Meru itogo fast track ate by mweri jwa June mwisho chibitari uchionde ukethwa kwena functional oxygen plants. Secondly, twina mitungi mbere na ndi tuthwa batu to produce oxygen yetu ge plant ire chiongwa te amumiru akiri ate kunywa ruo itwina mitungi 555 area oxygen oxygen ira tumbete kwithirwa ituko supply ndene chibitari chionde cha Meru County kwa utio umba kwithirwa ugo nande ugeta withokiagia Meruke. In fact nowadays thirikari ne classify te Meruke nande indawa if it is classified as a drug, you can be sure how serious we are on it in terms of that provision.
Na inkona we have so much to batira kwetha tukidiscuss, but Dr. Gatumi tutudethera tukarakia mantu yeginya nutrition either chetu chikodira, but what could you say maybe kire achiari bara maybe bako hope kona ana in future bara expectant na kinyake county government. I know your ndaitari nayo kakia kana minister nayo kakia thimo yeku every now and then we ateri yako kakia, but mwire what you like them to do kiro angirone ndiro agie delivery na kinyanto kona ekuru kona ana kenda when you're in your line of duty unyewe kwa we satisfied that tutina any 15 to 19 years getting children maybe.
Yeah, nutrition is very important there mwekuru au plan ko yananda kana rera kama data no tutuerea kayananda mwana na need some nutrients na ya all through the mother na rera kuwa atakuwa tena proper nutrition iwe kia affect we na pia mwana no tu mwana ambao charare underweight na tukane kuendekana service singishi ya kuwa pengine aka need kuwa kena special nutrition kala nyago chara mbele ntu itira kinya wana kwenda more services in nursery. Ministry of Health recomendaga nutrition nini supplementation mono na kire iron and folic acid. Mheshimiwa bora omba utotebia especially nutrition ni to make sure that all the facilities ni kuashena those supplements available kendarea mwekora wa the antenatal clinic atukani kwa kinenkelwa readily available. Kure other nutrition aspect that should be considered kire ebukuria mother and child booklet then a lot of information concerning vyakula bwete kuwa kire pregnant na kuona all the groups of the food na what amount is supposed to kwa inko recommend mwekoro wondere akuwa pregnant akadikire the clinic na kwena ekakwa kuka antenatal booklet. Second request ni kire minister to make sure that maukoma kwa makiwa mare available in all facilities no to kweme previous to watu na short ya maukwam au tukarea mwakura kwa akuja in the antenatal clinic ndipo atuka atena access to this information kura na kabukwa kana kwa kithoma what is required for the nutrition aspect na pia kewe na kenda kwa na mwana ako ari healthy.
Well, Bwana Minister, oyikwa the request what would you promise maybe Mukariomeru na bon your colleague on Twana itario yawe na nyawo ni maybe what would you promise to fulfill the supplements? I think that's a very important thing kiri ndani ya machibitari. Is this achievable?
Yanko na kuga bwana imana this is achievable na mantu ya tukethroa imbonete the IGK budget area tutagwekera itukwenda gwekera mbecha chia milioni 200 ja 60 ke uguri bwanda awa kenda chibitari tikeje kwithroa ni kwagia ndawa alafu kwena gentu kenge tugukurukia gigwetwa FIF bill tugukurukia FIF bill ati mbecha ira chikwithroa chikiuma chibitari area ira ajio kwithra bakerea ni ntuba services ira bakwithroa bakionora bakewa chiethro nyachongo chigotigwa o chibitari ria kenda chiomba araba tutumbuga ndawe itikungana ira tugurite na mbeche chietu mbeche iri ingina cyo chikwithro mwaji akiri warea inyachongo chigachoka kwithro no chikugura ndawa cha chibitari u kenda chiomba kwithro ichigotethia ajie para bakuja ge chibitari u kwao inkwenda go promise mumeru ati ndawe inkwandikana karamu aja iria daktari auga na inyani ngonde pharmacist inkomenya nteto ichi ndawe ichi aikana shua mumeru otemwe kurukinya omwe urio geta ANC visit ukethirwa akiagia ndawe iria na tuku encourage kurubatu na bo muntu akethwa na kwambiria mapema akethro mwana we nandi na kwithwa supplements ira na guchiona mapema na mauku daktari Gatumi itugo promise Mumeru tukutorea tuga provide chibitari chonde cha Meru. Yes,
thank you so much nonto bako fine time na kinya kwarania na batwe and twikira promises bona CCM na twakurandura when time comes getha Gatumi ringi mwire bira wetirie ri nwerwe na kinya oni nkethira nkiura kiana nibo ya nonto bako faida kanya kwithira bukiwatanira na batwe mutegeri tukari na Dr. Dennis Mugambi ora no minister Ugima ndeni account ya Meru na kinya Dr. Consenta Gatumi ora nende ni mutaalamu mantu yegie kinyo chiari kinyo uchiari in general actually na nibo no tubakwithira bukiona kanya na kwatana na batwe mutegeri ono tukutatuika gatanta kero ari rwetu orobweru ari briefly ngukari ndaitare lakini ankathomendetwo ona chekinya thaithato nusu tuchimani nyuma kaita